Meeting. This is Jane Wilkinson. We'll get started here in a couple minutes. There is a recording that just went on, so if you prefer to listen to the recording later, you're welcome to log off. Otherwise, we will be recording this meeting. I'll go ahead and get it started. Presentation format. Today is going to be slightly different because our content is a little shorter, a little less information. So we hope to have a little more of an interactive discussion, kind of a panel update. So we'll start as usual with a couple introductions. We're going to do some, we have Elizabeth on to talk a little bit about vaccines and some of the work we're doing. We don't have a date yet for vaccines for children under 5, but we're going to talk about how we can gather input from you, from your families. And I'll have Elizabeth talk a little bit about that. And then we have Elena doing some updates, and then our partner updates. There's also an update from our Felisa Kane from Children with Special Needs, and some work that they're doing and hope to reach you with. And then we plan to have more space in this meeting for you to unmute if you're interested, but always be able to put your questions in chat. So do that all the way along. Anything that comes up, anything you're thinking about now, feel free to put it in. And we hope to include your voice a little more today. So thank you for coming. I'm going to turn it over to Elizabeth.
Hi, good afternoon, everyone. Thank you very much for having us here. I'm Lisbeth Mendoza with Boulder County Public Health in the COVID emergency response. And also we have Chris Campbell today with us, who is going to help us with another part of this presentation. Just briefly, we just want to touch real quick on this because we know that parents are interested in learning more about the vaccines that are coming for the small ones. Some of them have questions, some of them have doubts, fears, and so on. So we're here to offer any help that we can, our introduction to those resources. So the first question they usually ask is why would it be important to vaccinate our kids, right? If they don't get sick. So just for a clarification, there are many pieces of information out there that are not really that precise, and that is one of those because kids do get sick. Kids that are unvaccinated have the same risk that any adult unvaccinated to get COVID. And also, we see in these kids, usually, even when we don't see them gravely ill and ended up in a hospital or dying, but we do see the chronic consequences of those who have been hospitalized. We see long COVID, and we have seen the multisystemic inflammatory syndrome in these children. And the other reason to get them vaccinated, well, because we do have a vaccine to prevent contagion, to prevent infection, and these vaccines have proven over and over to be safe and very effective in preventing severe illness and hospitalization and death. And again, this is just a very brief, fast talk. So basically that's the idea. We have a resource that is important, is available to us and free. So that's why it is important to take them to get vaccinated. Also, well, just real quick, some lessons. There are so many lessons that we have learned about the confidence in the vaccines, but just a few of them. When the parents, when the adults are confident that these vaccines work, and they see that they allow us to go back to work, to go back to school, to go back to meetings, reunions, and being with family and friends, then they tend to go more to search for a vaccine. Fortunately, there are many places where you can get a vaccine, and there will be places to get a vaccine for the little ones. So it's important to help people gain confidence when they have questions, to just be empathetic with them, be really hear what they have to say, because truly parents have very relevant questions, and they are right in trying to choose the safest option. And in my particular case, as a mom, I trust that this is the safest way to get immune against COVID. Natural immunity, for instance, is something that we have also learned in terms of confidence. People tend to think or believe what is being said, that natural immunity is more potent than this immunity that is taught through the vaccines. And that is another piece of misinformation. That's another thing we have learned. And we're going to be very glad to explain this to anybody who would like to learn more. So the vaccines are the safest way to go. And there's so many other lessons, but the important thing is that we, as resources for them, can listen to them, and we listen to you, and figure out what is that we can answer, what can science answer at this point, and what are the things that we can't, but that we trust. Um, Even when what I mean is, even when the research is emerging, as we all have learned through the year, research is emerging. Well, that's where we are trusting. Well, and then the other thing that before I turn it to Chris, other thing I wanted to share is we have a lot of resources that we really want to put to service for you and your parents and all the people that you work with. And I want to talk about 5 real quick. And you're going to receive links to this. But one is, if you're interested in hosting a COVID vaccination update or an educational event at your regular meetings, or maybe having a presentation, a question and answer session, a town hall with your communities, please reach out. My email is lnmendoza@bouldercounty.org. Through this resource, either me or another expert and representative of Boulder County Public Health will be able to discuss and answer specific questions about COVID vaccines and present the latest research, present the latest data. Um, well, the second thing that I want to introduce to you is our Boulder County Call Center for COVID-19, where you can find a team of bilingual research navigators that are very good and dedicated to assist the community members in finding, those things that have you know have been happening because of COVID-19, like helping people find things as housing, things as utilities, food, groceries, transportation, economic help, vaccines, of course. Where can people get vaccines or information? So again, this is a bilingual service, and the phone number is 720-776-0822. And they are open Monday through Friday, 9 a.m. to 2 p.m. In the case that you want to communicate later or at different times, you can always send a question to our general COVID question email, which is healthinfo@bouldercounty.org. You can send any question and it will fall into our call center and you will get a response. The third thing I want to share is our wonderful equity vaccination clinics that we are hosting at the Longmont Hub. And these clinics are welcoming to all because they are equity clinics. And this is for people 5 and up who want to get a COVID vaccine. We have at these clinics all the vaccines available so far authorized for the use in people 5 and plus. And also we have the vaccines against influenza for 6 months and older. Again, Spanish and English bilingual staff will be on site. And for now, they are offering $100 US Visa gift card to all those people 18 plus completing their vaccination course, meaning the second dose of Moderna, Pfizer, or their J&J dose. The fourth resource that I want to mention, and this is really quick, is our website where you can find other providers of vaccines beside this Longmont Hub. And this is www.boco.org/COVID vaccines. And in Spanish is the same, boco.org/COVID vacunas. And the final resource that I want to talk to you about is if you want to be added to a weekly update that we run for our community partners, our cultural brokers, this update will get to your email, and you get COVID-19 frequently asked question of the week, and vaccination clinics. Where are the community clinics? Where are the clinics happening near to our county or in our county? Please feel free to email me again for this, and I will make sure to add you to our group email. And now I want to pass it on real quick to Chris. And any question, please feel free to email me. Thank you for your time.
Thank you, Elizabeth. Jane, should I go ahead and jump in, or are we gonna? I know there was a question there.
No, you go right ahead, Chris.
Excellent. Hi, everyone. My name's Chris Campbell. I'm the emergency manager with Boulder County Public Health, and it's always so good to meet with this group. It's been such a long road, and we're excited to work with you all. I wanted to give just a real overall update on what we're looking at for the 4 and under vaccines. It's been challenging to see. We were hopeful that we were going to see these vaccines come online, and it's been pushed out a bit. But generally for our response, we're really looking and connecting with providers, making sure they're ready to go, and really connecting with groups like you to get all the information we can to you. So we're starting with this education component and confidence, and then when the time comes, make sure vaccines are available. And we want to work with you all. So we'll look ahead to potential clinics. There's lots of clinics throughout the county that should be available for us. So I just want to provide that information that we are watching very closely the process for these vaccines for the younger age groups 4 and under, and we'll continue to communicate with you all as information becomes available. What we'd like to work on with you all now is certainly just connecting with parents and caregivers, getting them the information they need to make good decisions. So that's where Elizabeth has been remarkable in this work. We also are going to gather some more data and more information in focus groups from parents and caregivers. It's something we've done in the past around vaccines and childhood vaccines, and we're using a similar model. So we will share that information with you all, and would ask that you share that with parents and caregivers that you work with. This is going to allow us to really dig into questions that families have, parents have, caregivers have around vaccines, and kind of lay the groundwork for a long-term connection with this group around other vaccines, other childhood vaccines, along with COVID vaccines. So you'll be seeing more information on that in the coming weeks. We're real close on that. We're working with a great group that's helping facilitate those focus groups. There'll be incentives to participate, and it'll be a great opportunity to gather some information to inform how we connect with families and caregivers. So really appreciate that opportunity to see you all. We're happy to answer any questions. Elizabeth's a remarkable resource, and I just want to thank Elizabeth, has been working in town halls and vaccine education since the inception of the vaccine campaign. And, it's been really helpful for our community to get timely information and accurate information from trusted sources.
Thank you, Chris and Elizabeth. And I can't see the chat from this view, so if there are some questions right there, we have a few minutes you could answer them, or we can wait to the end if more come in as we go along.
Yes, there was a question about the clinic in the Longmont Hub. I placed the answer in the chat.
Okay. I think there's a number of people who may have called in and can't see chat. So if you want to just say the question and answer, might be helpful.
Yes, absolutely. So the Longmont Hub is located at 515 Kaufman Street in Longmont. And you can find the pre-registration or just to secure an appointment. You don't have to make an appointment, but if you want to secure an appointment in our website, there will be, let me see here. Let me find the website here. Is www.boco.org/COVID vaccines. If you go to that website, you'll find this clinic and other clinics. and you'll find the links to secure an appointment in there. Right now, again, you can just come over and you won't be asked for an appointment. You can register right there. Remember, it's on Tuesdays, 3 to 7 p.m. And this is the one that is offering also flu vaccine, and along with the other COVID vaccines, and the $100 gift card for those completing their courses of COVID vaccine.
Jane, I was hoping I could ask a question really fast.
Yes, of course, Abigail, right?
Yeah.
Thank you.
I wanted to say thank you to Chris in particular for helping us to get our employees vaccinated and for all your work on testing. I know that people in this group, myself included, really appreciated that. I guess some of what I wanted to say is a quick comment, but one question I have is whether you guys are considering reopening the fairgrounds testing in the fall, assuming that, you know, things happen the way that they will probably happen in September and October. The second question that I have is, most of us are in the midst of re-enrollment right now. Currently, we're not collecting any information on children's COVID vaccination status. Is that something that we should be collecting? And if so, is there a recommended form for that, or we just ask for a copy of people's vaccination cards? And then I guess the third part is just sort of a comment, but you know, I strongly encourage my families to get vaccinated. Obviously, it's the best protection that we have at this time, and I'm thrilled that kids under 5 could finally get vaccinated. But we know that these vaccines aren't particularly effective at preventing infection, just severe illness and hospitalization. And so I was hoping that the isolation or quarantine guidance would be taking into account that, you know, after 4 weeks, looks like most of these vaccines are about 12% effective at preventing actual infection. So I was hoping that that was going to be considered when the quarantine and isolation guidance was made for this age grouping. And I suspect that that's going to be the hardest part in communicating the importance of these vaccinations to parents, is knowing that they're not super effective at preventing the actual infection. And, you know, these parents have been told repeatedly that children's risk of hospitalization is pretty low. I've not yet seen the data for under 5s and whether that's actually true. But, you know, that's sort of been the narrative they've gotten.
Yeah, thank you. That's a good summary. And Elizabeth or Chris or maybe even Elena might have a comment.
I can take the testing question first, and I appreciate the message. I likewise want to echo this group has been incredible. So thanks so much for these conversations and working with us. From the testing perspective, yeah, I know it was challenging that we sunset the fairgrounds. We're working with CDPHE, looking at the fall. I mean, I think we're definitely concerned about the fall and potential seeing an uptick in this disease in our community. So I hope we can just all enjoy the summer together, get outdoors, enjoy the weather. Plan for the fall is what we're looking at. I can't say if we're going to open the fairgrounds or not. I do hope that is a potential. So what I do know is the state health department, CDPHE, has contingency plans in place. So should we need to use those like Mako Medical like we have at the fairgrounds, they'll still be under contract and still be looking ahead. And it is a potential to have that back up and running at the fairgrounds. I know that has been a key resource for our community, particularly in Longmont. So it is in our plans to have those contingency plans in place for any kind of fall surges that we may see. We want to continue to work with you to get you access to rapid antigen tests likewise. So those are the two areas we're looking at from a testing perspective. Lots of other questions there. Elena, I don't know if you want to touch on the isolation quarantine. Elizabeth, maybe some of the questions around vaccines, effectiveness, some of the messaging we'll have with families there.
Hi, Chris. Yeah, I'm happy to touch on the quarantine bit there. So we are continuing to follow CDC guidelines for isolation and quarantine. And this is also what the state of Colorado has adopted for their COVID quarantine isolation guidance as well. So per this guidance, once these young children are eligible for vaccination, they will be exempt from quarantine as long as 2 weeks have passed since completing the primary series and they remain asymptomatic. So for example, if a parent in the household comes down with COVID-19, at least 2 weeks have passed since this child has become fully vaccinated, they technically can be quarantine exempt, continue attending care, but again, we would expect you to monitor them for symptoms, and they would be recommended to get tested as well.
Yeah, so regarding the effectiveness or the efficacy of the vaccines, so the studies, the final reports of the clinical trials are still to be released to the public, the complete. So that's where we're going to see how does it look like at the very end, the effectiveness of these vaccines with the third dose or with the second dose, and as well as the side effects that are expected to see from the kids. But we agree the issue of the effectiveness is going to be an important one to talk to the parents about, and also be careful with that messaging of natural immunity is just more potent because it is dangerous. Natural immunity is like saying, if you want to avoid getting hepatitis, why don't you just get hepatitis? No, that's dangerous. So no, that's not still we have some level of effectiveness, and that's the safest way to go. But again, there is still a lot of information to be released, and that's what we're going to be informing, all the numbers and everything.
And I don't know if anyone can speak to the requirements of a COVID vaccine at this point. I haven't heard that it's on our list of required. No, so we'll have more information to come on that. If at this point it's not a list of required.
Yeah, in terms of, and I know there was one more question around documenting vaccination status, or I don't know if I can answer that one, Jane. That might be one we might dig into with the team, or maybe, and if you have thoughts there, I don't have an answer to that right now. What kind of documentation needs to be done? So we'll follow up on that one. Maybe get back to this group if that sounds okay.
Yeah, I think that's valid, because I want to make sure we get the right information. So exactly. Yeah, I can include that in notes, or I'll send it out as soon as we have more information. So thank you. All right, then. You can still submit questions in chat if you have them on vaccines, but I'm going to move us along so we can cover the important information that Elena always shares. Oh, I'm sorry. Before Elena starts, Felice Kane wanted to just have a minute or two with you to talk about a training that is available for childcare.
Hi, Jane. Thanks.
Hi, sure.
So I'm the coordinator for the Children with Special Needs program. And we do offer nurse care coordination. So many of the families in your child care may qualify, and we're certainly welcome to, you're certainly welcome to send referrals to us. However, I will spend most of my time talking about the ABCD training. So ABCD stands for Assuring Better Child Health and Development. And it's an hour training. And what we're really focused on is to take just a step back from the training for a moment. So we're dedicated to improving the developmental screening and referral process, and we're focused on kindergarten readiness. And so the training focus on helping to identify developmental concerns. A lot of times it can manifest as behavior issues, and how to submit referrals depending on the age to early intervention, how to talk to parents when there is a developmental concern. And so our trainers, and we partner with Imagine to provide that training. It's free. And you're welcome to contact me for questions about that. And about Children with Special Needs program or the ABCD training. Anything I should add, Jane? I feel like I missed something. Maybe you can put my email in the chat as well, or I can.
Yeah, we can do that. No, I think that's important. And I know it's come up with children with special needs may have had disproportionately impacted by COVID. So I like to include it in this content just so that there is a support available for welcoming children and families. But no, I think that's it. Thank you, Felice. And yeah, I can include we can include your email in chat as well as in the follow-up notes, because Elizabeth has a few links she wants to include as well.
Perfect. Thanks for inviting me. Thanks for your time.
Sure. Thank you. So Elena, please take it over.
Thanks, Jane. And thank you to my colleagues for presenting that really relevant information for everyone on the call today. We are going to primarily focus on providing an update today for our community and ECE-based COVID data. We'll touch upon the latest updates regarding the BA.2 variant. And I'm going to move through this a little quicker than usual, just so we can make sure that we have a significant amount of time afterwards for our Q&A session. But as always, these slides will be shared with you, or the recording will be. So if you have questions on the data, you can always return to it at a later time. Okay, as always, a huge thank you to the team. We couldn't do this without the amazing teamwork from Krissa, Latoya, Kaylin, Anna, Griselda, and Kara.
It's almost one word, the team.
Okay, so we'll get started with our data from the community. So this is the metric that we've been visiting for the last couple of months. This is the CDC COVID-19 community levels. And again, this is a metric that is determined by 3 different indicators. So tending to the first column, we're looking at the number of new COVID-19 cases per 100,000 population in the previous 7 days. And when the CDC looked at this data, that landed at a little over 60 per 100,000 population. So that puts us in the first category. And then the second 2 indicators, which are related to healthcare utilization, we have our new COVID-19 hospital admissions per 100,000 population in the previous 7 days, and that was 1.8, which squarely puts us in the low category. And accordingly, the percent of staffed inpatient beds occupied by COVID-19 patients in the previous 7 days is also in the low category at 0.6%. So all of these metrics put Boulder County into the low community level category. And this is a map that's showing where all of the counties in Colorado landed at the time that this data was published. And at that time, which was through March 31st, all counties in Colorado remained in low community levels. And these recommendations are tied to our community levels. So given that we are in a low community level, the recommendations for the general public include staying up to date with your COVID-19 vaccines and getting tested if you have symptoms. Of course, this is just for the general public, and within ECE settings, you may choose to implement additional protective measures. Okay, so now we're going to look at a few of these metrics in a little bit more in depth. And it's important to point out that the data windows or timelines for these graphs are a little bit more recent than what the CDC was using. These all come from our internal surveillance team. So the first one is our 7-day incidence rate. So the rate of new cases per 100,000 population in the previous 7 days. And through April 4th, the point estimate for this was 74.3 cases per 100,000 population. So a little higher than the CDC was using, but again, it's completely typical for the data points to be slightly different depending on the source and the time period that the data was collected for. So 74.3 is, I guess if we were using our old levels, I do not believe that's what put us in high. It's still higher than, of course, we would like to see, but it's definitely in a much more stable place than we were seeing at the beginning of the year. Okay, and this is the same metric broken down by age group. And again, we want to attend to that kind of medium blue dashed line, which represents the rate for 0 to 11-year-olds. I know it gets a little crowded towards the right-hand side of the graph. So that 0 to 11-year-old age group saw 59.2 cases per 100,000 population, which is slightly lower than what the rate is for the community-wide. However, it did increase from the previous week by 22%. Okay, and here's our percent positivity metric. So as of April 4th, we were sitting at 3.8% positivity. So as a reminder, that means 3.8% of PCR tests that were collected, within a doctor's office or a lab that gets transmitted to CDPHE electronically. Those are what's included here. It does not include any at-home tests. So this 3.8% positivity was a bit of a drop from the previous week where it stood at 4.5% positivity. Okay, so to wrap this all up, looking at the community metrics, our case numbers, hospital beds in use, and hospital admissions do remain low. This means that the current stress on our healthcare system in Boulder County is low. And as a reminder, the recommendations for the general public are to get fully vaccinated, stay up to date, and also get tested if you have symptoms. Okay, so now we're going to pivot and look at data and trends specific to our childcare community in Boulder County. So this first graph is our running frequency of the number of ECE-related cases reported to us. And so this includes, again, staff and childcare attendees in Boulder County. Now, our y-axis gets a little skewed because of just the incredibly high rates that we saw in January. So in the next slide, I actually kind of broke it out to only look at trends since the Omicron surge. Okay, so same data, but we don't have all that noise from the Omicron surge to kind of make it difficult to read. So as you can see, ever since February, there have been week-to-week fluctuations in our case rates. Nothing incredibly concerning, but it's kind of hard to tell where it's trending at this time. Okay, we do currently have one confirmed outbreak of COVID-19 in a child care center. We have seen a moderate amount of cases, and we're kind of on the working theory that this is increased transmission from the BA2 variant paired with the absence of masking, which has likely contributed to spread among attendees and staff members. And we are working with the facility on mitigation strategies to limit further spread. Okay, we're going to pivot outside of Boulder because this is important information that is relevant to our childcare partners in Boulder County. So this data comes from the Children's Hospital Bug Watch, and this does indicate that moving it through March and into early April, they are seeing a rise for influenza A. So really important to keep in mind that COVID is not the only respiratory illness that is on our radar. And we should also be concerned about children that are presenting symptoms that are consistent with the flu as well. Okay, and this also comes from the Children's Hospital Bug Watch. So in addition to seeing a rise in influenza A, they also saw a bit of an uptick in rhino and enteroviruses, as well as a small uptick in parainfluenza. So again, this is just a really good reminder to follow how sick is too sick for exclusion and return criteria when either children or staff have symptoms of an illness or a positive test for a specific pathogen. Okay, so circling back to summarize our key messages for childcare providers in Boulder County. Case rates have been fluctuating week to week, no clear trend at this time. We'll still continue to keep a close eye to see if cases rise as the proportion of BA2 rises in our community. Again, increasing levels of BA2 may lead to earlier spread or easier spread, especially in the absence of masking. Early mitigation is key, so we ask you all to remain alert for early signs of illness in your programs and connect with us if you suspect COVID-19 or any other illness. Even if you don't have test results yet, we do want to make sure that we can intervene early and protect others from getting sick. And as a reminder, for those that are experiencing a cluster or an outbreak, we ask you to please prepare to implement previously used public health mitigation tools such as temporary masking, quarantine, symptom screening, and other strategies that have been successful in the past. Okay. So we have focused on the BA2 Omicron sublineage a bit. So this is kind of in case you missed it, we're just going to do a really quick review. So BA2 is more infectious or easily spread than BA2, which is the form of Omicron that drove our recent surge back in January. It is likely already the dominant form of the virus in Colorado. However, the good news is that in terms of vaccine effectiveness, severe disease, BA2 and BA1 seem pretty comparable. So not as likely to cause severe disease as earlier forms of the the virus that causes COVID-19, and our vaccinations remain protective against severe disease and hospitalization with BA2. And also early evidence suggests that prior infection with BA1, such as back in January, February, should provide strong protection against infection with BA2, but reinfections can occur. So if somebody is presenting with symptoms of COVID-19, even if they've had an infection within the last 3 months, it's still important to evaluate their symptoms and potentially assess them for a reinfection. Okay, so here we have a visual. Again, BA2 is present in Boulder County. We have clinically detected cases and we've detected it in our wastewater, so it is here. And this graphic right here represents the proportion of the different variants that constitute our cases of COVID-19 in Colorado. So this is an estimate, and it's really important to note that the process of sequencing to figure out which variant a positive test is associated with can take weeks. So there are significant delays with this data. And that is something, again, that happens just because of the inherent timelines to actually do this testing. But with that said, you can still see that on the far right, we are seeing an increasing range of that yellow bar, which reflects the prevalence of the BA2 variant compared to BA1. So you can see that over time, BA2 is displacing BA1, and that's because, again, it is more infectious than BA1 was. So when this data was sourced, it looked like BA2 accounted for about 36% of cases in Boulder County. However, recently the state has disclosed on calls that it likely already is the dominant form of the virus. And again, this data just happens to lag. So we're going to bring this full circle. I know I already touched upon this, but just understanding that BA2 is becoming or already is the dominant form of the virus, we really, really want you all to take us up on our offer to do mitigation consultations, to reach out to us with really early signs of illness. It is a lot easier to break that chain of transmission and stop the spread if we can catch it earlier on versus later on. So again, even if you don't have positive test results back, but you have suspicion that there's some respiratory illness circulating in your program, go ahead, reach out to us at our Health EC email address, and we can often get on the phone within an hour or two of that request. So during those calls, again, they're very informal, and we can discuss those tools such as masking, quarantine, symptom screening, cohorting, and really have an honest conversation about if they would be effective options to implement to kind of protect others from becoming ill. Okay. And so this is going to do it for me. We just always have our standing slide here as a reminder to please email healthececovid@bouldercounty.org if you have any COVID-related concerns, cases, etc. If you have other illnesses circulating, you can absolutely reach out to this email and we will connect you with one of our epidemiologists who works on non-COVID issues and conditions in childcare settings. Also, please take advantage of our office hours, which are every week on Wednesday from noon to 1. Very informal. You can bring your questions, concerns, and we can chat about anything related to COVID. All right. Thank you all for your time.
Thank you, Elena. I also wanted to add that we are working, Elena and her team and myself have a meeting scheduled with the child care health consultants later this month. So we're working to help them understand this kind of reset recovery from COVID so that you will have that kind of support as well. And partner update, I'm assuming Jody is on the call. I can't see, but Jody, if you're there, please give us any updates for CCAP.
Thank you.
Sure.
You assumed correctly. Here I am.
Yay.
Thank you, Public Health, for being such a great partner as usual and presenting all of this information, and for all the childcare providers for keeping up with it all. It's a lot. Really quickly, I just wanted to mention that I have been sending out via our Constant Contact program some updates about every other month-ish. But if you, and I did notice that, you know, for some folks, it goes to their junk folder. So I'm just gonna copy in this other email address, which is info@bouldercountyhhs.org. Again, it's info@bouldercountyhhs.org. If you could add that to your contact list and your email program, that will help ensure that you get our updates. Also, I think I wanted to point out that the majority of our fiscal agreements with you all are coming up for renewal at the end of June. We will be working diligently to get those to you with 60 days notice, so you have time to, you know, look through it with any changes and get them back to us. Between this Friday, which is April 15th, and May 1st, that's when they will all be starting to, our team will be sending those out to you. And we hope to have them all finalized before June 30th, so that there's no lapse in our agreements and we can continue serving all the families that we serve. So thank you. I'll pop my information into the chat as well if you have any other CCAP questions.
Thank you, Jody. Amy Carlo from Early Childhood Council or one of her colleagues is on the call. Please update.
Hi. Yes, I really wanted to share about this exciting professional development opportunity we have coming up in May. It's Touch Points, now called Touch Points, the How of Child and Family Engagement. For those of you that aren't familiar with Touch Points, it's through the Brazelton Network. It's an evidence-based approach to building strong family and child relationships from before birth through age 5. It's a 5-module series, and in addition to 3 class dates on Saturdays in May, there's also reflective sessions to work with our instructors, Lorene Phillips and Susan Moore, and that goes through on Wednesdays in June and the beginning of July. Not every Wednesday. We know people will be on vacation and things like that. But we are really excited about this. We're hoping to continue to offer more Touch Points trainings in the next year as well. And registration is now open on our website. And please let me know if you have any questions. Thank you.
Thank you, Amy. I always leave space for Office of Early Childhood. If Shannon or any of your colleagues are on the call and have an update, I'll give you some space here.
Hi, this is Jen Girdler with Office of Early Childhood Licensing Specialist. I don't think we have too much right now, but I did just get word that the updated admin guide for the new rules that went live in December is now posted on the OEC website. So I know we always use that as an extra resource to clarify some of our rules and regulations. So it's good to hear that that's up.
Thank you, Jen. Thank you for attending. And I just want to mention that our next meeting, as we continue these, we have had discussion whether it makes sense to continue it, but as long as you're all showing up and interested, we'll keep hosting. So our next one is May 9th. I'll send out that link with the notes for this meeting, and I list the Healthy CE COVID email on this page for information. And I'm going to drop the screen so we can see if there's other questions. I wasn't able to see chat, but I think Elena was watching it. Maybe Tori's been watching to see what questions have been coming up. Elena, if you want to answer any of the questions or manage it.
Hi, sorry, I was trying to unmute myself and accidentally kicked myself out. So,
Oh, that happens.
delay. Yeah, I noticed a couple EPI related questions, so I'm happy to address those. I'm just pulling the chat back up. Okay, so sorry, everything got reset when I rejoined. Okay. There we go. So first question was, what is considered an outbreak for the flu? So that's a great question. It doesn't have the kind of same level of definition that it does for COVID-19. The reporting requirements for childcare providers would be to monitor for absences due to influenza-like illnesses and connect with us if you see kind of an above baseline level of influenza-like illness. Of course, our team is always more than happy, and we prefer that you are on the side of caution if you have concern. So I would say, an example, if you had, 2 or more individuals that both came down from the flu, and we're talking recency, like within a week or so of each other, and they're kind of linked, like same classroom, or may have been together for a bit, a period of time for some activity. That does sound suspicious, and that is absolutely something you can reach out to us for. But again, the reporting requirement is to monitor for increases of ILI from baseline. Okay, moving on. If a reinfection is suspected, would an antigen test be indicated, and would it be accurate? So I'll break this down into 2 parts. First, yes, an antigen test would be a recommended course of action if somebody is presenting with COVID-like symptoms, but they've tested positive within the last 90 days. And the reason is that PCR tests are highly sensitive and can pick up pieces of inactivated virus, even if someone is no longer contagious. Whereas an antigen test is, focuses more on, do you have an active illness at this time? So if somebody had COVID-like symptoms, they tested positive on an antigen test, we would take that as strong evidence of a COVID-19 reinfection. In terms of accuracy, accuracy does differ depending on the manufacturer of the antigen test, and they are more accurate when used in kind of a serial format. So we definitely recommend that everyone follows the manufacturer's instructions, and that may include retesting with 36 hours later if that first test was negative. As always, a negative test does not completely rule out the chance that someone is infected with COVID-19. So it's really important to make sure that you're following how sick is too sick and making sure that you are excluding individuals with signs of illness if it's indicated. Okay, next question. Are there any considerations on modifying the quarantine and isolation guidance? At this time, I'm not aware of any active discussions. We are making sure that at this point we are in alignment with CDPHE's quarantine and isolation recommendations. And at this time, CDPHE's quarantine and isolation recommendations are in alignment with the CDC. So if the CDC were to put out any updated guidance, there would very likely be internal conversations about potential changes. But at this time, there is nothing on the radar that I'm aware of. Okay. Question, should we expect a home test if a child travels to another country regardless of symptoms? At this time, there are no requirements that someone needs to be tested after returning at the county level. We don't have any requirements in place, but it is a good idea to keep up to date with the CDC travel requirements. CDC travel recommendations, which may include a return test, which could either be PCR or antigen. Okay. I'm going to read this question. Speaking to the accuracy of antigen tests, we inquired recently with a Colorado-based pediatrician who told us that their clinic stopped using antigen tests as the sensitivity and specificity are nullified when community levels are below 10% positivity. Can you speak to this and provide your recommendations input to using these for symptom or screening tests? Yeah, so I can't speak to the decision from the pediatrician to stop the use of antigen tests. They are still recommended for use by the CDC. What it sounds like they were referring to is a concept that we've talked about on this call before, negative predictive value or positive predictive value, which basically means, so for positive predictive value, if you have a positive test, what is the likelihood that you truly are infected? And on the flip side, negative predictive value being if your test is negative, what are the chances that you truly are not infected with COVID? And those are impacted by community levels or community prevalence. So where they're coming from is probably a concern that with low community prevalence, it might increase the likelihood of a false positive in the sense that if someone tests positive, the likelihood of them being truly infected might be lower than it would be if there was higher community prevalence levels. So that is some really solid epi nerd information right there. A little bit more than we really need to dive into. I think the main takeaway there is there could be some concerns about false positives, but at this time, I'd say if someone is symptomatic, they're being assessed for COVID, they have a positive antigen test, that does, to me, speak to being pretty solid evidence of a current infection, and we would recommend isolation for that individual in that setting. In terms of screening testing, which is slightly different, so someone who is asymptomatic, no known exposure, but maybe they're attending a camp, I would say that if you have someone who's asymptomatic, test positive, and you have concerns of a false positive, reach out to us. Don't brush it off on your own as a false positive. Reach out to us and we can talk to you, learn some additional information about the specific circumstance, and maybe consult with our medical officer to see if this is someone that likely needs to be retested or treated as a case for isolation. But at this time, there are no large recommendations to stop using antigen tests. I think this is just a case of a pediatrician being extra cautious on their behalf. Okay, that's it for what's in the chat.
I think there's a few other comments that we updated in chat, and the Office of Early Childhood, if Shannon, if Lisa is available, we have a couple minutes now, and she'd like to mention a training they're offering on to support mental health of children and families and staff. Or Jennifer, if not, I can put that in next month, but we have a few minutes now if you'd like to.
Sorry, trying to unmute. I can present some slides really quickly.
Sure, you can share the screen if you'd like.
Give me 1 minute. I'm not usually in Teams.
Yeah, sorry, I know we kind of put you on the spot, and I'm just double checking in the chat as we. Yeah. Nope. There you go. Great. Thank you.
Yeah. Okay. So for those of you that are aware, early childhood mental health consultation has been a program in the state of Colorado for over a decade now, but earlier this year, we launched a brand new resource. So this is an extension of the early childhood mental health consultation program. It's a toll-free number in which you can access a live qualified consultant Monday through Friday from 10:30 to 5:30. So we just released a brand new communication toolkit. I'm just going to kind of run you through what this program is and where you can find more information. We would love your support either in accessing this new resource yourself or pushing it out to your community and making sure they're aware of it. So essentially, what is a support line? It is a non-crisis line. It's no-cost confidential resource for anyone who's caring for children under 6. It can help families and caregivers better understand and support the emotional well-being of young children in their care. And the consultant, as I mentioned, is qualified master's level mental health professional who also has an infant and early childhood mental health endorsement. They carry active caseloads in the field and they also answer the phone. They can discuss needs, brainstorm appropriate support resources, and connect you to consultation team in your local community. As I mentioned, this is a no-cost resource, Monday through Friday, 10:30 to 5:30. And so really when we say any adult in Colorado caring for a child under 6, we mean those very traditional roles we think of as early care and education settings, including licensing specialists, early childhood counsels, coaches, teachers, and directors, and also the populations that haven't been served as regularly to date, families and home visitors, early intervention service coordinators, family resource centers, even librarians, and many more. Through the use of on-demand interpretation, the support line can accommodate up to 200 different languages. And then really quickly, why? We created this new resource and extension to increase equitable statewide access to early childhood mental health information, resources, and referrals. We really wanted to increase awareness and reduce the stigma by connecting adults to timely resources with consistent high-quality customer service. And we also were working hard to network and build meaningful partnerships between our early childhood councils, community mental health agencies, counties, and statewide. If you like any of the social media posts on the side, they can be found at earlychildhoodmentalhealthcolorado.org. And then I will drop the toolkit link into the chat. Or if you would like a presentation from the consultants or myself in the future, we can introduce this to your organization or other parties. So we have some FAQs. You can find this information and more on our landing pages. So Mental Health Starts Early and the Spanish equivalent. And then the toolkit, which I will drop the link, is available in English and Spanish. Almost all the materials are facing parents, families, or professionals. We have an FAQ, posters and postcards, some web graphics, and some animated social media posts. We also have some electronic newsletter blurbs. And for professionals only, we have a one-pager that really says who, what, where, how, and why you should engage. So you can see examples of those posters here. On the left, you'll see the parent-facing one, and on the right, the provider-facing one. Also some postcards, very strengths-based, with the idea that no matter how long you've been caring for children, there's always a new question, a new challenge, a new opportunity to have a thought partner or build your strategies and skills. Web graphics look very similar. And as I said, we have a social media post with some language that accompanies it.
And Lisa, I assume you, I think maybe you already sent this to me, but I can include it in our follow-up notes as well. I know people are asking for some of the information in chat, and I can include that with our mailing to the Boulder County group.
I can do that.
Thank you.
And then this is the one pager, and we are making our rounds. But again, if you have any other ideas on folks that we should share this information with, and then the toolkit and link to request a presentation. So I will drop those in the chat, and then I will be sure that you all also have a PDF of this presentation. Thank you for the extra time.
Thank you, Lisa. And also, I wanted to mention that the Boulder County resource for this service, for this mental health service, will be connected to our mental health partners. So if any of you have been working with Kid Connects, Bethany Garrett Myers, she will be the response for there. So it's not in competition or instead of, it will be with her. Correct, Lisa?
Yes, so the line itself is intended so that you can get quick access and talk to someone during business hours, but those any referrals or inquiries go right back out to your community. So yes, it would be Bethany at Mental Health Partners and her team.
In fact, Bethany, over the coming year, will be changing her warm line to align with that, so that it won't be two different lines that you'll be using inside. But just so you know, Bethany's included in this. Bethany's part of this. It's in collaboration. Just wanted that to be clear. So thank you, Lisa. Thank you for putting it in there. And we know that's such an amazing resource that's been long in coming. So I'll make sure to put that in the notes as well. And I think we did answer everything. wanted to make sure that I saw a lengthy, Kelton had a lengthy question. I think Elena answered most of it. And we're right at one. I'm sifting through them really quick. Yeah. And the Elizabeth has a number of resources that I'll also include in the minutes so that you'll get those. It might take us a day or so to get those, to get the recording downloaded and so forth. But I will send that out, and we will be sending any updated information as we get that. So thanks everyone for attending. The recording will be downloaded, and I'll get that out with the PowerPoints as soon as possible. Thanks for all of your work. Thanks for hanging in there. And you know how to reach us. And Wednesdays are a great option too. Wednesday office hours are a place to bring all of that information that you might be struggling with on a day-to-day basis. So have a great afternoon. Thanks to the presenters and all.
Thank you.